Impact of the Spanish flu on World War I. Origins of the Spanish flu. The Spanish flu, caused by the H1N1 influenza A virus, emerged during the final years of World War I, around 1918. Global spread. The Spanish flu became a pandemic, rapidly spreading across the globe due to increased global mobility, including military movements. Military movements and transmission, troop movements, crowded military camps, and the close quarters of trench warfare facilitated the rapid transmission of the virus among soldiers. Wartime conditions. Overcrowded and unsanitary conditions in military camps and trenches created ideal environments for the flu to spread. Effect on combatants. The flu affected soldiers on both sides of the conflict, significantly impacting the health and combat readiness of military forces. Impact on morale. The widespread illness added to the physical and emotional toll of the war, negatively affecting the morale of troops already enduring the hardships of combat. Strain on medical resources. The Spanish flu strained already stretched medical resources, diverting attention and supplies away from treating war-related injuries. High mortality rates. The flu's mortality rates were high, and in some cases, surpassed the casualties caused directly by the war. Global death toll. The Spanish flu is estimated to have infected 1/3 of the global population and resulted in millions of deaths, exceeding the total number of casualties from World War I. Impact on civilians. The flu also had a severe impact on civilians, with many succumbing to the illness on the home front. Demographic impact. The flu disproportionately affected young, healthy adults, altering demographic patterns in the affected regions. Social disruption. The pandemic caused social disruption, with widespread illness leading to economic challenges, labor shortages, and disruptions in daily life. Post-war unrest. The combined impact of the flu and the war contributed to post-war unrest and a sense of disillusionment. Effect on peace negotiations. The flu affected the conduct of peace negotiations and the drafting of the Treaty of Versailles, as key figures, including President Woodrow Wilson, fell ill. Second and third waves. The Spanish flu had multiple waves, with the second wave being particularly deadly. A third wave occurred in the winter of 1919. Medical advances. The experience with the Spanish flu highlighted the need for improved public health measures and spurred advancements in medical research. Impact on vulnerable populations. Certain populations, such as indigenous communities and impoverished areas, were disproportionately affected by the flu. Legacy of grief. Families and communities worldwide were left in grief, with the flu's impact resonating for generations. Role in historical memory. The Spanish flu's impact is often overshadowed by the war, but its role in shaping historical memory is increasingly recognized. Economic consequences. The flu had long-term economic consequences, contributing to challenges in post-war reconstruction and recovery. Influenza and bacterial co-infections. Many flu victims succumbed to secondary bacterial infections, as antibiotics were not yet widely available. Public health measures. The pandemic prompted the adoption of public health measures, influencing future responses to global health crises. Research on influenza viruses. The Spanish flu stimulated research on influenza viruses, leading to a better understanding of their transmission and prevention. Global collaboration. The pandemic highlighted the need for global collaboration in addressing public health crises, a lesson applicable to contemporary challenges. Historical context of the pandemic. Understanding the Spanish flu's impact adds a crucial layer to the historical context of World War I, emphasizing the interconnectedness of global events.